the Successful Book recording happening. I'm so excited about this interview. I cannot wait to pick your brain, Dr. Araghi. I'm so excited. I say that every time, but this one is going to be an awesome one. Dr. Araghi, I've known you for a couple of years, and to say that you've completely changed my life is an understatement, and we're going to get to that little story later. You've been a GP since 2001. You started with integrated functional medicine, studied 12 years ago. To say that you've got a lot of experience with what you do, again, is an understatement. I am so excited to hear what you've got to say today. Welcome to the Successful Bookkeeper Power Hour. Can't wait. Thank you for joining us.
Thank you for having me.
Okay, shall we get started? Because look, I have spoken to obviously a lot of women over the years. Obviously, most of my clients are bookkeepers, or all my clients are bookkeepers, most are women. And the things that I hear coming up all the time, I know with my journey with functional medicine doctors, I've been working with functional medicine doctors now, personally myself, for over 20 years. Can you just explain to us, Dr. Araghi, what is a functional medicine doctor?
The biggest difference between a functional medicine and what we call as any specialty in medicine is that you can call functional medicine a subdivision of a physician as such. And as a matter of fact, in countries like the United States, is categorized as a subspecialty for physicians. So sometimes you can call them a metabolic medicine, sometimes you call them functional medicine, sometimes you call them integrative medicine. In Australia, there is a college that is called College of Environmental Medicine, and that is basically the college that accredits our training. So all those names kind of cover, they're trying to touch parts of what a functional integrative medicine do. But perhaps the word functional is one of the most, I guess, practically used terminology to define it, and that is, we try to improve your functions. We try to improve everything that is relevant to how you operate, how you live your life on a day-to-day basis. And this is all about the fact that as a human, we look at you to say, what parts of your life, is it psychological, is it mental, is it physical, is it energy, is it sleep? Everything is interrelated. I mean, as a woman, you guys probably will understand this a lot better. I mean, how many times a woman just get up and have a shower and said, oh my God, I'm losing a lot of hair. You know, that affects your health. That is important for a woman. But if you say that to an average doctor, they say, well, so what? You're going to lose a bit of hair. How's that going to matter? You're just aging. You're just aging. You're just getting old. That's just getting old. Or how many times do you go to a doctor and say, for example, I am tired?
Yeah.
You know, they say, well, I think you're aging. You know, those kind of answers are the answers that we are here to respond to. You know, we're here to explore and see if we can help you. Yeah.
What I thought was fascinating, and certainly for me 2 years ago, like, and I guess mine, because I've got Hashimoto's, which is a thyroid problem, I was, to say I was exhausted, I mean, to think that like I've been on this functional medicine journey for a long time. So for me, it appears that not all functional medicine doctors are the same, right? Because I felt like at that time, I actually decided to take so to put it into context around my situation, I decided to take 3 months off, because the way that it was turning out for me was, yes, I was exhausted. I was so tired, like just fall asleep in seconds and just dragging myself along. And yes, I still kept up my running, and I still kept up, you know, all the stuff. I always had jobs that demanded a lot of me, which we all do. But I just felt like even when, sorry, I've got some feedback. How do I stop that, Lou?
I think it's gone now. Yeah.
Gone now. Even when, like, when I took the 3 months off, like, I knew that this was the kind of business that I wanted to have, you know, having, you know, sometimes 100, 150 people in a webinar room and hosting that. And the thought of that back 2 years ago, of actually being able to, because it was almost like the thoughts in my head, I had the idea in my head, but to actually get the words out of my mouth, it was almost like, it's hard to describe. It was like an anxiety. It was like a fear or like, it was a funny feeling. And I thought, I've got to sort this out. And I did a whole bunch of research. I Googled and Googled and Googled. And I was like, okay, there's got to be a solution. And then my whole journey then that unfolded with, obviously blood tests and all the things as a functional medicine doctor does. It's like, it's not just, even to the point where, I've read where you're losing eyebrows, like the people that are losing eyebrows. I didn't even know that, Dr. Ali. I mean, the things that I'm a researcher, but that's not normal. As you get older, you're not meant to be losing your eyebrows, right? So it's kind of, I didn't know that. So all of this kind of journey, I feel like it's like layered on layered, but certainly, to say that you've changed my life is an understatement. I feel like now I'm more me now. Like I felt like I was detached from that for a long time. And what I've gone through with you has just made it such a difference for me. So I've been seeing functional medicine doctors, as I said, now for 20 years, and nearly everyone I speak to about functional medicine have never heard of them. Why do you think it's such a secret? It's like no one I speak to goes, oh yeah, I've heard of functional medicine. Very few people have heard of functional medicine doctors. Why do you think that's the case, Dr. Ali?
Look, number one, because when you were, I remember this from when I was doing my training in the US, one of our trainers was Dr. Andrew Heyman. Andrew is a well-renowned doctor, everybody knows him. And he said, in one of the conferences, he said, my father always asked me, he said, Andrew, what sort of job do you do? What kind of specialty? What do you actually do? And Andrew said, as I started explaining, he said, son, I just always wanted you to become an ophthalmologist. So I just call you an ophthalmologist. So in a sense, it's like, because it's the word has never been that catchy word of a specialty. You call somebody a surgeon, you call somebody, for example, an eye surgeon or colorectal surgeon, or for example, a gynecologist. It's not those catchy words. That's what it's never gained a lot of, I guess, traction in the public arena as such. But, and also you got to remember, the whole area of functional medicine is only about 25 years old. It's really not that old. So it's probably the youngest specialty of medicine ever. Now, just to give you a bit of perspective, when I was 2010, was doing my studies in the US, they were talking about making that a specialty affiliated through the George Washington University and University of South Florida. And that came into effect, I think in 2016, it became a specialty of subspecialty of physician. So you can only imagine that's why nobody knows about it, because number one, there are very few doctors in the world who have done the studies to get to that point. And number two, it's not a publicly funded college like all the other colleges. It's a private college. It's done through, most of the guys who got their training, they've done them through the US and a couple of other places. And most countries in the world don't even have them. Like they don't have that integrative functional doctor at all. They've done their training somewhere else and they come back and done them. And what's really fascinating, Sharon, you could also be a cardiologist, but also be a functional doctor. You could also be, yes, that's right. So this is what's actually becoming very fascinating. So in America, they have got functional integrative cardiologists. They've got functional integrative surgeons. If you look at the Dr. Stephen Gundry, Stephen Gundry is a heart surgeon, right?
Yes, he's the
everyone would have heard of. Yeah, he's the one who written the Plant Paradox book.
That's it.
Stephen Gundry is an integrative heart surgeon. In a sense, you go to Stephen Gundry and he offers you, when you've been referred to have open heart surgery and bypass, he offers you, he said, do you want me to open you up and give you 4 new arteries? Or do you want to follow my protocol to see if your heart's going to get fixed itself? Now, that's brave. That's something that nobody other than Steve Gundry in the world can offer you. He's the only person in the world with the capacity to say, I can offer you an option of no surgery and fix your heart with no operation. Now, this is where the field comes. So that's, it's not actually a secret. It is the fact that it's very new and it's very young specialty.
Okay. Because I know for me, like it's been about probably nearly 20 years that I've been seeing functional medicine doctors in some form or another. So I started out quite early then. By the time I didn't realize that I was only so young. So, you know, I know that you see men as well as women, but I'm sort of focusing a lot on women because it's who I work with the most. So in your opinion, what is the most common issues you see in women that suffer that they don't need to? So things like, you know, as you said before, tiredness, negative thoughts, hormonal highs and lows, depression, anxiety, all of these things, I think, as you've said, you know, before, we feel like you go to a normal doctor and they go, oh, it's just, you know, you're busy, you're doing a lot, you've got a business, or you've got young children, or you've got like whatever it is, and you kind of think, okay, well, maybe it's just me, or maybe this is just the way it is when you get older or whatever. So in your opinion, out of those things, is it something we have to put up with, or is this something that you're seeing regularly? And what are the things that you're noticing that are the cause of these things?
Look, the first thing that I would say, let's look at the woman's journey. You know, in the last 30, 40 years, how many of women are now expected to be in the society, present and work? And they've got high-powered jobs, they've got stressful jobs, and they have got a far more presence in the community than they used to have 30, 40 years ago.
Yeah.
The second aspect of it is that, let's face it, a woman's life is derived by hormones. So in a sense, they function very differently to men from the time of the birth. So yes, of course, from the puberty all the way to childbearing and all the way to what we call as a perimenopause and menopause. And what's interesting is that quite often I see these women that go through life with and with a quite good coping capacity. We call them coping reserves. So basically, they go through the stress of having a child and child rearing, and then having a bit of a relationship breakup and a divorce, and then having to get up on their feet. And they get usually somewhere in the vicinity of the 40 when they really start to see things happening to them for no reason.
The impact of that, yeah.
Yes, and when I say things happening to them for no reason, is something that unfortunately a lot of our colleagues are notoriously in the wrong when they say, well, sorry, you're just depressed, take this antidepressants, you'll be fine.
Yeah.
Or sorry, I investigated, I couldn't find any reason why you were tired. When something that you've never experienced before suddenly starts to happen, and it's related to that 40th, you know, the 40th decade of your life, you got to always remember there is a very important element. All those changes that you went through from the age 9, 10 to 15, 16, when you got your periods and everything, are now the same forces involved that are going to now reduce your hormones and take you through what we call as the menopause and the change of life as such. And a lot of the time, I'll come to this, I think it's part of the other questions that I'll get to this, is menopause does not manifest itself with what women believe in themselves, that it's going to be hot flushing. No, I'm not menopause because I'm not hot flushing, or I'm not menopause because I'm still getting my period. What I said to you is that, remember, all of those changes occurred 7 to 5 years before you even get your period, when you were 9, 10, 11, 12, and then finally you got your period 5 or 6 years later. Remember, it's going to work exactly the same way. You get all those emotional things first. You get depressed, you get anxious, you get changes that, you know, libido drops, you become more irritable. And irritability, just simply irritability, is a very good sign to say, why am I irritable? Why am I cranky? Why am I, you know, shouting at the kids, for example? Or why am I, you know, losing my control over nothing, for example? Sorry, let me just turn this up. I've got a little software that I need to deactivate.
Right. So these things, what you're saying, Dr. Ali, is that these things are completely normal. Like when it's coming up, it's a normal thing. So
yes,
yeah, and so
and and you need to take them from a different perspective, because they're all happening as a natural progress of what you have experienced. And there's one more element that I always, again, it's always overlooked, is the fact that there is a big difference between a woman who's never had a child and a woman who's had 4 children. Okay. The more children you have, the quicker you go through these changes.
Right.
The more stress you have had in your life, the quicker you go through these changes. The more, I guess, what we call as the allostatic burden, the more toxic environment, bad food, weight gain, smoking, alcohol, all of those things, the quicker you go through these changes.
Okay.
So again, there's no one size fits all. If you're experiencing symptoms, you don't know why, you got to go to the right person to explore the right reason for it.
Yeah. And so that's the thing. So when you think about going into menopause, or like when you're going through those changes, it's, it's stuff that we don't have to put up with this stuff, do we? And like, when I think about, like, I'm not a sweet person. I don't like ice cream, but all of a sudden, man, I'm hankering for an ice cream, and like the feelings that I go through, it's completely different to what it was, 5 years ago even. So is it something, right? I know that, the sort of things that you talk about are relatively natural, but we don't have to put up with this stuff, do we? We don't have to go through these feelings of anxiety and I guess grumpiness, and I guess weight gain, all of the things that we feel when we're going through these changes. It's something that we don't have to put up with.
Correct. Absolutely not. Sharon, you got to look at how the world has changed in the last 200 years, particularly. I touched upon it from the fact that how a woman's life has changed. In reality, our lifespan has changed. Our expectations from ourselves have changed. And we are finding ourselves living longer and longer and longer. And in reality, Sharon, these days, it's pretty normal if someone comes to you and said, well, I'm 95 years of age. It's not, you don't say, oh my God, you are old. No, in reality, there are very many 95-year-olds out there who don't even take a single medication. They're super healthy. So there are many factors that involve in there. And one of the most important things, I remember this from one of my colleagues, more senior, that I was trained by. He used to say, we don't have the potion of youth. The closest thing we can get to the potion of youth is to restore and rebalance your hormones and restore them to the age of 35 and keep you at that age. So if I can restore men and women's hormones back to the age of 35 and keep that level going, even at 95 years of age, you will have a very good functionality, very close to a woman who is 30 years younger than yourself.
Wow.
And if I put it to you this way, when we start treatment of for example, a woman at 45 or 50 years of age, there is very little difference between two women at age 50, one taking hormones and one not taking hormones. Now, we studied them for 10 years, probably about 20% difference at age 60. This one will have more energy, this one will have less energy, probably a little bit more stuff she can do, a bit more tolerant, a bit more lovely as such. This one is a little more cranky, a little bit short-tempered. Now, you studied them for another 10 years. This is like this line of gap. It starts getting bigger and bigger and bigger. By the time they get 70, they're quite different. They're very different. Like a 70-year-old woman who has done everything correctly, have been on the hormones, have exercised, has done everything to improve her health, is going to be in a much different place to another peer of a 70-year-old who can barely do anything. She's tired. She just want to go to bed, just barely do anything outside of the house. She confines herself to the house. The whole social life has been, distorted. She probably has had a couple of knee replacement or hip replacement, and probably taking a blood pressure medication and this and this and this and this. You take that further to 80, Sharon, at 80 years of age, the difference is like day and night.
Is that right?
I've got 80-year-old men and women that are playing tennis games an hour, 3 days a week at 80 years of age.
And that's just like with the cocktail that you
That's
do.
it. Just basically the cocktails.
When you say like had hip replacements and things, are you saying that they having like this assistance can help with things like that as well? Like you're not so susceptible to knee replacements and hip replacements and things like that. It helps the
100%.
whole body.
Sharon, helps everything. So I give it this way. Okay. Imagine your menopause starts, all right? the first thing that happens post-menopause is that you lose your estrogen, progesterone, testosterone will be gone out of the window. All right. Now, your metabolic rate, as soon as you lose your testosterone, estrogen, your body starts to change the way it metabolizes the energy. How? Because your body, you become less active and you start to lose more muscles and regain that weight back as fat. So in a sense, you might say, well, hang on, doctor, I haven't gained anything. I'm still the same weight as I was when I was 35 years of age. Fantastic. But if someone has measured your bone density and muscle mass, you will see now that 55, you have a lot less muscle mass than age 35. And women sometimes notice it themselves, said, you know, doc, I'm the same weight, but now flabby around belly. And I used to be a size 8, but now I'm a size 10 or to 12. So I don't get it. Well, that's exactly what has happened. Because remember, if you compare a kilo of muscle with a kilo of fat, fat has got a much larger volume. It's the same weight, but larger volume. So you lose the muscle, you gain that in fat, you get bigger. So interestingly, for every kilo of the muscle you lose your metabolic rate.
Right.
So you burn less energy with the same movement.
Okay. Wow.
Okay. Now, on the top of that, Sharon, you start to develop a lot of sugar cravings because you're fatigued, your hormones go, you start to feel a lot more fatigue. So you eat more chocolate, you eat more. Now, hang on, that doesn't end in there. You come home, you're more irritable. The first thing you go to is a glass of wine to calm my nerve down. Okay. Comes nighttime, hot flushes starts, and I can't sleep. Then, you know, your sleep is disturbed. You wake up first thing in the morning, you're so tired. Okay, let's just have more coffee, more coffee, more coffee, more coffee. And that all adds up. And before you know it, you're a different person. 5 years into the menopause, you are doing lots of little things to make your own life easier.
Yeah, interesting. Wow.
So it all adds up backward. Yeah, go ahead.
So is it like, as far as like discovering when this could be, so it's like, you know, I guess the trigger is for a lot of people is when we start experiencing these feelings. Definitely for me, it was like, okay, well, you know, I don't want to feel like this anymore. Like, you know, that whole thing. Have you heard of that before, where you've got it's like, you know what to say, but you can't get it out of your mouth? I don't know what that is. It's a weird thing, isn't it? I don't have that problem now. So what, like, with this knowledge, what do you think stops us investigating this further? Like, if we're going through this, is it time? Is it just not sure that, like, you know, how you can kind of get doctor fatigue, right? You go to a doctor and they go, you know, all of the things that stops people, or is it money? Is it like, what are the things that would prevent people from actually going and investigating this further? Like, by the time they've got to you and you're sort of looking at their blood tests. I know with me, we've done scans around with mold, like how much mold can make a difference in your life. Like, I didn't even know that mold, like being in a house that's damp and we see mold. I mean, I've heard of this before, but I just didn't realize the repercussions of being in a house with mold. Like, did you want to talk a bit into that? Because I think it's pretty important.
Yeah, I can talk about a bit of a mold, the exposure disease and mold biotoxin exposure. To be particular about the mold, particularly in Queensland and many other parts of Australia, unfortunately, it's again one of those new areas of medicine where we now know that the spores of the mold are microscopic and they're so small that we can inhale them. And as you inhale them, they go through the lungs and they readily are absorbed through our bloodstream. And again, for the sheer fact that they're very small for starters and they're very hypoallergenic to the body, they don't create a massive response by our immune system. So they kind of go unnoticed inside our immune system. And they're also capable of passing through what we call as a blood-brain barrier because they're fat-soluble particles. So they get into the brain and they could cause some of those symptoms that you just mentioned. That is, we call them brain fog, basically, that your brain is like in a cloud and you're trying to compute or say something or make a decision, but it's just not coming to your tongue. It's like being disconnected. And that's because of what we call as a cytokine storm. It creates a massive soup of inflammation that your brain is swimming in that soup now, and it just can't operate properly. Now, mold biotoxin is by far, again, created a lot of traction because, again, it's one of those newly coined terminology by Dr. Richard Shoemaker in the US that did a lot of studies, and they recognized that, okay, so the water damaged buildings, they're a real thing, and they actually deteriorate your life and your health significantly. And a lot of people present to the doctor with just a constellation of symptoms varying from sinus infections or sinus congestion that are intermittent, eyes burning that are intermittent, fatigue, brain fog, joint aches and pains, and essentially they'll turn into autoimmune disorders from all the way from ankylosing spondylitis to Hashimoto thyroiditis, rheumatoid arthritis, you name it. They could turn to anything. So they're kind of interrelated, those conditions, to some degree. And while the diagnosis is a little bit tricky to diagnose, the treatment is very easy. Yeah.
What's the treatment?
The treatment is we use binders. So we kind of need to, because these spores, they get excreted through our bile, and bile gets excreted through our gut in order for the digestion of the food. We use a bile acid binder that doesn't let our body reabsorb the bile, because bile is recycled through our body. So we kind of don't let the bile go back anymore. And that's basically how we treat them.
Okay. Interesting. So you mentioned autoimmune diseases. I'd like to go deeper into that a little bit, because I guess like Hashimoto's, I believe, is an autoimmune disease. And
Correct.
From my research of 3 months on the couch and reading, it seems that from my research, it seems that if you've had one, it's the likelihood of you having a second autoimmune disease is highly likely.
Correct. Yeah.
Are you able to talk a little bit about like the most common autoimmune diseases and how they affect us, and how you help women get through those? Is that a possibility?
Of course. Yeah. Look, we now know that at least for the last 30 years, we have had a drop in our infectious disease conditions, such as, you barely hear about the measles or rubella or, tuberculosis, or any of those things, because thanks to the world of antibiotics and vaccination, we've managed to get rid of all of those conditions or reduce them. And of course, I think more important than any of them is the hygiene that people have these days. We're far more hygienic than we used to be many, many years ago. But at the same time, we've had this rapid rise in many different autoimmune conditions. Some of them, they're, every year we're naming and coining new conditions every year. So one wonders that, for starters, why are they on the rise? Why are we having far more autoimmune conditions? To answer that question, I think, first of all, we're not quite sure. We just don't know completely. But some of the strongest beliefs and some of the studies, they tend to point to gut microbiome. They're all now pointing a finger at the fact that, okay, if it's not our own genetics, if it's not all the things that we know, then what is it? It is most likely the gut microbiome. So why gut microbiome? Because by far, let's face it, Sharon, it's the only thing that we have treated literally like shit in our life and said, you know what? It's gut microbiome. We don't care about it. We don't know what even it is. Who cares about bacteria? Let's give antibiotics and antibiotics and antibiotics. So it's directly related to overuse of antibiotics. And unfortunately, Sharon, it is now changing, of course, but unfortunately, until we lose a whole generation of currently practicing doctors, the idea wouldn't change. The respect to gut microbiome is something that needs to be learned by the doctors. 90%, the majority of our doctors, I would say, saying a number is probably not the right thing, but majority of our doctors, if you ever ask them this question when they're prescribing antibiotics for you, said, doctor, will this antibiotic have any adverse effects to my health? That would just fob you off. And they say, no, just take it. And in reality is that if for every single antibiotics that you take, no matter what condition you take it for, Sharon, you are going to increase the chances of autoimmune disorders and a lot of health complications in your body.
Is that right? So what is, so if somebody's out there that have taken a lot of antibiotics for one reason or another, what's the like remedy for that? Is there something that like you can reverse that, or is it like that just compounds? Or
Look, the knowledge is in infancy. We don't know yet, but to give you the extent of the damage, to put it this way, Sharon, okay? Have you got your seatbelt on, ready to tell you this interesting sentence? Professor Ian Fraser in Australia is running a largest trial at the moment in the world of mapping the human microbiome genome.
Wow, this is exciting stuff.
So Ian Fraser, for your information, is the guy who actually created the cervical cancer vaccine. He's part of the Queensland Institute of Medical Research, and he's been around for a long time. He's a very educated man. And we now know, thanks to some of these research that have been published, that 25% of your gut microbiome only exists in your body and your body alone.
Okay.
I'm not talking about population. I'm talking 25%
of
billions of bacteria. 25% of the species belong to Sharon Francisco's only.
Interesting. So what does
your
that
sister
mean?
doesn't have it, your brother doesn't have it, nobody else in the world has it.
Okay, so what does that mean? Like, what does that mean from a bigger picture point of view?
From a bigger picture, Sharon, it means, number one, they dictate who you are as a human being.
Oh, interesting. So then, like, so the more compromised they are, or the more that they're not, that's what affects us. Like, that's what causes all these effects.
Correctly. So next time, if a doctor is prescribing antibiotics for you, say, doctor, you are trying to change my personality. These antibiotics can make you cause depression for the lifetime, can cause anxiety a lifetime, can cause obesity a long time, can cause insulin resistance lifetime, can cause a whole battery of conditions for the rest of your life. Wow. Incurable. Forget about it. Incurable.
So what about what about if you've got something that requires the use of antibiotics? What's an alternative of that for that?
Okay, so this is an interesting point. Number one, there's a lot of research at the moment they're happening in terms of finding antibiotics that are disease specific. Because remember, we don't have any antibiotics that disease specific, all right? How many times you've been to a doctor who's given you amoxicillin? Did you ever ask the doctor, said, doctor, is this the right antibiotics? No, that's what we have. We have got an amoxicillin, augmentin, and, clavulanic acid, azithromycin, clarithromycin. We've got a few groups of antibiotics based on, it's really funny. Do you know how we categorize bacteria with response to the antibiotics? We call them gram positive, gram negative.
Right.
Gram stain is a bit of a staining methodology for the laboratory. It's a classification. Okay, so it's exactly like you say, okay, how do I know how many, how many types of human are in the world? We say it's very simple. There are the black and white. So we create something to kill all the white and create something to kill all the blacks. That's all. Well, is that really the fair way of dealing with, killing something? So in reality, that's how we're treating the bacteria. We're creating an antibiotics that works for the gram positive and antibiotic that works for the gram negative. There's no specificity to say, okay, this only kills this singular bacteria that has caused this singular condition. So the new era of antibiotics is working on targeting a single strain of bacteria.
Oh, this is very exciting.
Yeah.
So this is, I don't know if I'm right into futurist sort of stuff. I don't know if you've heard of Ray Kurzweil. He's a futurist. This guy is amazing. He's got like 21 honorary doctorates. He's just like a super smart guy. And
interesting, yeah.
Yeah, he's talking about this stuff too, where medicine, and I'd love to hear your opinion on this with where medicine is going, which sounds like it's similar to what I've been reading, is that specifically things will be designed for like you rather than like broad brush stuff. What do you know about that, and how is that going to change our lives?
Okay, so tell you this way, interesting. At the moment, there are capsules that you can swallow They go and sample a lot of things for you, and then you do a finger prick sampling. They get sent through your smartphone to a center, and that center will say, okay, Sharon, you've got all these deficiencies. I'm going to make you a particular capsule that addresses all those deficiencies for the next month. Do the same thing next month, and I'll send you a new capsule. So that's for the next 30 days. This is what you take. That technology is currently available. It's not publicly available, but we have got that technology, and there's a lot of startups. We're at the brink of something very, very interesting, very important that's happening. And from the basically funding perspective, Sharon, this is where it gets really scary, because our public models of funding, they're absolutely not designed for this. And this is where it gets.
And yeah, because the way that the government make money is because of the way the system is now, right?
Yeah. So in a sense, the way that the public health works, public health, the ideology of public health is supposed to be all inclusive. So it's supposed to have the same level of access for you and the same level of access with a person who's on a $20,000 income a year or is on a disability pension.
Yeah.
So that model for the future of the medicine is a failed model. It's never going to work. So we believe that the future of the medicine is going to be two prongs. One group will be the normal mainstream medicine that everybody can access. Then it will be the medicine of the elite and medicine of the outliers, basically, that they can access whatever they want. Yeah.
Due to their curiosity, or due to how much money they make, like their ability?
No. It's just the level of access, Sharon. Because remember, before things become quite mainstream, it will take a while before the prices start to break down.
Right.
And these things, unfortunately, will have they're pricey. There won't be a simple, straightforward thing. So for a lot of conditions, when these things are going to be available, the accessibility is going to be limited to some patients. Yeah.
Wow. Yeah.
So in the future, unfortunately, we will see this coming, and we'll have more restricted access, but we'll just have to see. Yeah.
So what's your opinion on timeframes around this? Like when will this become available, do you think, for the masses?
I think in terms of having a lot of these technologies integrated into our life, my personal belief is we're looking at a 7-year to 10-year period.
Oh, really?
Now.
So reasonably quickly, which is awesome.
Definitely, Sharon. Yeah. The speed has increased so much, and I tell you, for example, April 2022, there was the largest startup in the world with a $3 billion seed funding got established in the US. Their promise is they're going to have a product on the shelf available to everybody that prolongs human life by 25 to 35 years.
Wow.
And they promised, and they're promising this product, in 5 to 7 years maximum.
It's so exciting. Have you seen this book?
No, but I know Tony Robbins, yeah.
So he's written this book. It's the biggest book ever. So what he talks about in this book is, he's always had back problems. Yeah. Really bad back problems, in these things, he's jumping all the time and what have you. And I'm not sure why, how he got his back problems, but he was, I don't remember the complete story, but basically he had some issue and they said that could be fixed with stem cell.
Yeah.
And I think it was only in Mexico or in South America somewhere. Anyway,
it's Panama.
Is it? Yeah, this particular issue that he had, he got the stem cell, which was human stem cell. It was all legitimate, he said. Yep. So he took this stem cell and he broke something. He broke an ankle. So anyway, because he said that he had this particular thing that he was doing, that he needed to be back on track. Anyway, it fixed that within a short amount of time. But what it also fixed was his back problems. He's always had these back problems and they're completely gone now. He said it was just, and a lot of his stuff that he's talking about in here, is all the things that you're talking about. It's like just groundbreaking stuff that's going to completely change the way medicine is. So it's exciting, isn't it?
Yeah, absolutely.
So I wanted to talk more into, I've always had this belief that, that women are absolutely beautiful, and that unless you feel like, as a woman, unless you feel absolutely gorgeous and you love yourself. And I've always and I think it's Dr. Ali, I don't know, I grew up in the country in the middle of nowhere, right? And I think I just didn't have that feeling that I just grew up, and I think it's because I didn't have other people around me. Like, we were like an hour and a half out of the town. I was with my mum and dad, and they always told me I was beautiful, and I'd like, okay, I'm beautiful. And I just never thought that, I just never had that feeling until I went to town and started school. And I'm like, oh, people don't love themselves. And it was a real shock for me. It was like, oh, what? Like, of course you're beautiful. Why don't you think you're beautiful? And so I've kind of always had this underlying thing that all women are beautiful. And if you don't feel beautiful, we've got to find a way to get that back, because, if we don't love ourselves, like, it's so important, I think, that we just absolutely, we love ourselves for who we are, whatever that is. But then if there's things that's stopping us, and I'm going to bring it back to business, because that's where it started for me 2 years ago when I took those 3 months off. And I'm like, there's these things that are preventing me living my fully expressed self, right? I can't get on a Zoom meeting, or I can't get on a stage and feel fully expressed, because I can't get what's in my head out my mouth, because I feel so anxious and it feels awful. So my goal, I guess, underlying goal, is obviously to create financial security for as many bookkeepers out in the world as I can, because that's just my bigger overarching goal. But also, I think that feeling to help women feel absolutely amazing about themselves. And I just want them to have the feeling of that. And so if we were to talk about a first step with that, so I know, look, I've got Meniere's disease, which is severe vertigo. And I had in 2014, I had 15 drop attacks with this Meniere's disease. And I went to ear, nose and throat specialists. I went and had brain scans. I had all this stuff. And they said, pretty much, you've got Meniere's disease, which is this cluster of symptoms. They don't really know what causes it. And they said to me, you're just going to have to put up with it, Sharon, and take this little Stematol tablet and that'll fix you. And it did nothing. I was having these drop attacks, which literally put me in bed for 2 days vomiting. And if I had a few out on the street in Brisbane. When you're laying on the street vomiting and you can't get up, I tell you, you look like you're drunk. So people walk around you, and it's the most horrible, vulnerable feeling in the world. And I'm like, I can't live like this. I couldn't drive. I got to the point where I couldn't drive for 3 months. So I Googled for 12 months, alternate cures for Meniere's disease, and just kept Googling and Googling. And I found this amazing doctor who I referred to you, Dr. Hannah, and he changed my life. So he's an upper cervical chiropractor that completely changed my life. And that's a whole other story, because I'll get Dr. Hannah on here as well to talk. So literally the first meeting with him, and he adjusted my neck. And essentially his theory is that all of our messages from our body come from our brain. And it was like there was a foot on a hose stopping the messages going through to my body. He adjusted my neck. I haven't had a drop attack since. I still see him every 6 or so weeks, but he stopped my drop attacks altogether. So my goal for my clients and bookkeepers out there is that if you're feeling stuck, or there's something that's stopping you achieving the revenue goals, and I have a personal belief that bookkeepers can have revenue from 7 to 1 million and beyond that if they want to. If there's something stopping you from doing that, and it feels physical, like tiredness or anxiety or all the things that we've just spoken about, what would be a first sort of step for a woman out there that's feeling these things to get their life back?
Sharon, as long as you travel the same path, you're always going to get the same results.
Yeah.
This is what I always say to my patients. Number one, start looking in a different place.
Mm.
What saved your life was, okay, what is the alternative treatment for many years? Okay, I've done it. I've been to the specialist. I've had the MRI done. How many more can I have?
Yeah.
How many more doctors can I go to tell me the same thing?
Mm.
So stop looking in the same place.
Yeah, nice.
Okay. So that's the first step. Look for something different. Let's just start searching for something different. And when you start searching, then the Pandora's box open. You start to look for, you start to find the answers. Some of them might be dodgy. Some of them might be, not too bad. Some of them might be the real answers. So number 2 is do not give up, or find a doctor who does not give up on you. Okay. I'll tell you a moving story in here. I have a gentleman, I've known him since 2010, actually, I've known him, so 12 years. When I met him, he was a very young, 19-year-old, fit, healthy apprentice electrician. And a year later, he lost his mother and kind of went through a bit of a spiral in his life. And he developed back pain. It was said, well, that's maybe he's not doing everything right, but he was very fit. His back pain progressed. And we did the scans, we realized, oh my God, he's got a back of a 70-year-old. It's just so old. This back has got arthritis at age 20, 21. What is happening? We sent him from this specialist to that specialist. This went on and on. And essentially about 4 years ago, this young man by then had an incident at work, which put him to bed and had to give up job. He hasn't worked for 4 years. Wow. His girlfriend left him. He became homeless. He had to move in with his father. Okay. He spent a lot of money on a lot of specialists. I've sent him to neurosurgeons for neurostimulators. I've sent him to pain specialists, several different pain specialists. Sharon, if I tell you the answer, it was, I never gave up on him. Okay. The final step was that we decided to send him to a person is actually a chiropractor to have a look at him.
Interesting.
All right. Imagine 2011, 12, the pain started. This is 2022. So 10 years of pain, all sorts of, you name it, injections and everything. Surgeon said, look, you've got a bad back. It's arthritis. We can't do anything about it. You just got to be. The boy is in so much pain that he cannot stand up for 2 minutes and brush his teeth. He has to sit down after a minute to brush his teeth. That's the level of pain we're talking about. Went to this guy. He said to him, you've got a short leg compared to the other one. Walk with one thong on and bare feet and get back to me a week later.
No way. And that was it.
That was the end of the pain. Gone for good. Gone for good. Okay, so this is what I mean. Number 1, look other places.
Yeah.
Okay, and sometimes as a doctor, got to remember, this is sometimes we offer you some of those services, but let's go out there and have a look. 80% of the doctors don't even believe in a chiropractor. They don't even believe in those things, But these things often work for the patient because the problem is so simple. It's like that thing that they say, look at the people who go to a jungle looking for a tree and they come back and say, we couldn't find any tree.
Yeah.
Because they don't know what they're looking for. They're not looking actually. So this is the second part of it. As I said, look for a different path and look for a doctor who doesn't give up on you and try something different. Then you'll get your answers. That would be the best way you try. Going from this specialist or that specialist, but in the same specialty, in the same arena, doesn't necessarily get you anywhere. I mean, how many times, how many second opinions can you, for God's sake, get? Essentially, one day you might be able to, and this kid could have finally ended up in someone's door and they would say, yes, that's fine, son, I'm happy to operate on you. Imagine they would have operated on him, put a synthetic disc in his back. And they said, well, I think I fixed you. Come back 6 months later and said, well, no, I'm back into square one. Hasn't done anything after a synthetic disc, I think it's cost about nearly $75,000 to get a synthetic disc put in, you know, to be told that, okay, sorry, you're paying back, I don't know. We did it to help you, but we can't help you anymore.
And he just wore a thong for a week.
Yeah, just for,
and
yeah.
this is the thing which I found it fascinating back when I found out about you know, Dr. Hannah with upper cervical chiropractic, and it's adjusting your atlas joint is what he does. And I'm like, oh my God, I found this miracle cure because it not only helps dizziness. I mean, mine was quite a severe thing, but it helps headaches, it helps migraines, it helps like all of these things, MS patients and things. I'm like, I've found it. This is me, Dr. Ali, because you know me well, but I rang the Many Years Association. I thought, oh, they need to know about this. Guess what I got? Nothing. Nothing. They didn't want to know about that at all because like I still to this day. So what I did was start a YouTube channel. So anyone out there, it's my little story about Many Years disease. I did it in actually, oh gosh, it's an old one. So I've got it out there to help. I thought, you know what, I'll start a YouTube channel. And it was back in the time, it was 10 years ago. It's back in the time before I'd even been on videos and things. And I just thought, I've got to get this out to as many people as possible because in mainstream, it's just not there. And to think that one adjustment fixed that. I stopped the drop attacks. And certainly now, like, you know, just through the process with you, just knowing that you don't have to have hot flushes. you don't have to put up with this. I've got the information in my head and I can't get it because I'm too anxious to talk or to, you know, all of the things. We don't have to put up with this. There's one thing, and I know we're running out of time now, but I've talked and focused a lot on women because obviously I work mostly with women, but I know that you're an absolute miracle man when it comes to men as well. You specialize in working with men as well with their problems. So I know that you don't just work with women. So you've certainly made an absolute game changer in all of my family's life, to be honest. So I'm really grateful, Dr. Ali. Is there anything else that you'd like to share with us just to round it up, or is there anything you'd sort of like to say as a final sort of piece?
As a final piece, I always say something to touch upon the mental health of women.
Yeah.
Something that I would say is that, remember, none of us have been brought up by parents who opened a psychology textbook and said, well, this is how I need to raise my child, and this is what's wrong with my child. We're all being brought up under, you know, presumption of our parents believing that they wanted to do the best for us.
Best they can, yeah.
So one of the things that I'm noticing, and it's very, very important, is that number one, try to have some sort of a self-awareness into how you are feeling and how you are dealing with your life problems and where you are at in your life and where you're sitting with yourself. And if you become aware of your problems, but you don't have an answer why, then don't try to sweep it under the carpet, because what we call as a neurodiversity in the brain these days is becoming a very, very important thing in the life. Things like diagnosis like autism or autistic spectrum disorder, ADHD, there's an implosion of them at the moment. There's so many of them getting diagnosed. And these are the people that are functional. And it's quite frankly, I'll put it this way to you, a lot of the time when even remotely someone tells somebody, I said, oh, you should have ADHD. They said, oh, I can't have ADHD because otherwise I would have never been able to hold a job or go to uni. No, that's a very wrong assumption. You know, a lot of the time we see people who have been successful through life and they've gone to many different places. But if you look at the casualties along the way, you see, okay, and they changed 10 times their jobs. They lost a couple of relationships, and they do this, they did this. Oh, the relationship with their father and mother broke down. Oh, they don't talk to the sister. All of those things are things that you need to take very seriously about yourself, because it's being underdiagnosed big time. Now, remember, we live with a population of doctors. When I graduated from uni, there was no ADHD in our textbook.
Yeah.
There was no autism spectrum disorder in our textbook. There was no Asperger's. All right.
Yeah.
We didn't have any of those things in our textbook. It's all new. And remember, I'm a relatively young doctor.
Yeah.
Okay?
Yeah.
So
That's it.
if you're going to a doctor who is 55 years of age, forget it. There's no way they know anything about this.
Yeah.
All right. And so that's one message that I'm trying to basically relate to the community these days, that take your brain very seriously, take your behavior very seriously. And if you think that you're different, don't just think that you're different. Try to pursue a diagnosis to find out exactly what is happening to your brain. And none of these diagnoses means, Sharon, that you need to end up with a medication or anything necessarily. It's just awareness to know, okay, this is how my brain operates. Okay, this is how I learn. I learn by writing, or this is, for example, how I talk. You should never put me on the spot, because if you put me on the spot, I will freeze. I can't talk. All right, that's a very good thing to know about yourself. And if you know it, you can adjust your life accordingly.
Yes.
To be able to perform better, all of those little things. So, for example, in your line of job that you just have to be, presenting in a live scenario, you might say, well, if I'm a neurodiverse person, I can't be put on the camera to talk to 100 people out there. Well, I might do a recording by myself in front of a camera, and then I, live stream it for other people. Well, that will work for you, not a problem. So recognizing those things for people are extremely important. Remember, we're all, if you look at the numbers, we don't hear very often these days that a person lives with the same person for the 50 years or 60 years. That era is gone. All of us are going through 1 or 2 or 3 or even more relationship. Now, is that a good thing or is that a bad thing? It all depends the reasons behind it. Did you learn from all of those things? Did you make sure the same mistake doesn't happen? Or are you going through life making the same mistake and not recognizing what is your pattern? Why are you repeating the same pattern all the time?
Yeah, I love that.
That's probably one message that I would like to pass on to a lot of people, to be able to pursue their recognition of their own self-awareness. And if there is a proper mental health diagnosis that needs to be made. It's not that difficult to diagnose with somebody with anxiety and depression. That's the easy part. The other parts, the neurodiversity, that is the hardest part to diagnose, because these people are considered normal.
Yeah, that's it. And that's why I love that you brought that up at the end, because this is my whole goal with my business, is to, like, whatever comes up, it's not a stop. And we kind of think, I always say this, it's like we hit this ceiling and we go, oh, I can't because of, and it's like, there's always a way around, right? There's always, like, if it's, I feel anxious and I can't speak, or if I feel not as confident as, like, if you're not feeling confident, there's confidence courses out there. There's always a way to get through that. So whatever's showing up for you, there's a way through, right? So it's just really refreshing to hear you say that, especially to sort of round it out, Dr. Ali. Thank you so much.
My pleasure.
I really appreciate your time. It has been absolutely amazing to hear and especially obviously the thoughts for the future of medicine as well. It's a very exciting space that you're in. And I'm sure that we'll have you back next year if you would be so kind to come back and join us. That'd be wonderful. I start a podcast next year, the Entrepreneurial Bookkeeper podcast. So I would love to have you join me on that. That would be awesome. Thank you.
Lovely.
Thank you so much. I really appreciate it.
My pleasure.
Okay.
Have a great day. All the best.
Thanks, Dr.
everybody.
Bye-bye.
Thank you.
Bye, everyone.
Bye-bye.
Bye.